joined by Dr NK Mehra, former Dean of AIIMS in Delhi, and Dr Sanjith Saseedharan, Head Critical Care of SL Raheja Hospital in Mumbai. Thank you so much, gentlemen, for sparing your time and speaking to Mirror Now. Appreciate it. Let me first go across to Dr NK Mehra. Doctor, what do you think is triggering this recent surge in cases? Of course, we did see Maharashtra Minister Aditya Thackeray on Sunday come out to say that this could be a potential fourth wave in the state. Your thoughts?
Charlene, I'm not sure whether we should call it the fourth wave. As you see that the life has come back to normal. We really, everybody in the country has come back to normal life. And you would expect an up and down in terms of numbers. As you saw that the last week that the numbers were around 2,500 to 3,000 a day. And yesterday, of course, we recorded about 4,500. I would still say that the numbers are much lower than what we are seeing in Europe and in the US. I would only advise three things. Number one, that the vaccination must go on. And the people who have got 2 doses, they must go for the booster dose. And now the good news came that the Corbevax vaccine, if people who have taken Covaxin or Covishield, if they take Corbevax as the third dose, is like a heterologous. And that actually has shown, the data has shown that the antibody titers even go higher. And not only that, even the T-cell immunity is actually heightened. So that's one point. The second point is that we are still seeing that the numbers are low. The infections are on the rise. The schools have to take care that the rooms are ventilated over there. The school, unless the schools make sure that the rooms are good enough, large enough, ventilated, that might actually have the children to bring back the infection back home. In terms of mask, as you said, that the mask has become a sort of thing of the choice. I would say imposing mask on everyone may not be the need of the hour, but we have to be very careful for those who are immunocompromised. People who have had an organ transplant and they're taking actually anti-rejection drugs. People who are known to be a cancer and they take drugs and all that. Others who are known to be primary immunodeficiencies and people with diabetes mellitus. I think for them, mask is a must. I think the government will have to really educate the masses. Actually, the people with immunocompromise must go back to their doctor, and they are the ones who should not come out in a crowded area, and they must wear the mask all the time.
Right. So in your opinion, the immunocompromised population, that is the vulnerable population, should be wearing masks. It may not be made mandatory for everybody, but at least the vulnerable population should be wearing a mask. Dr. Sanjith Saseedharan, let me come to you. We did see in the previous wave that was, of course, driven by Omicron. It spiked at a faster rate, but it also died quickly. Do you think the current variant, the current surge, perhaps could be triggered by the subvariants of Omicron that has been found in Maharashtra as well as in Tamil Nadu? And do you think this could also see the same fate like the previous Omicron wave?
Charlene, first of all, thank you for inviting me over here. Importantly, yes, we are actually seeing the variants of Omicron, but still, if you look at the INSACOG, the most important variant that is still circulating is BA.2. And BA.2 being a subvariant of Omicron, and the other subvariant they talk about is BA.4 and BA.5. We must understand these subvariants are accidents. They are not really mutations. And we know that accidents per se don't last long. So in that way, these are not the long-lasting variants that are aggressive and causing problem. Irrespective of that, even if there is going to be any kind of wave in any way from these kind of variants, there is not going to be any kind of significant impact on the public health system, and it will never necessitate a lockdown anymore. I don't think so. This is the way it goes. If at all there is going to be a wave, and it is going to be aggressive, it is only going to be if the virus completely mutates and forms a completely new variant of concern. These subvariants are not something that will be causing anything. I believe this will be very mild, will not affect normal life, and I think lockdowns are a thing of the past for Mumbai for now.
All right. So according to you, lockdowns are a thing of the past. Let me in fact take the same point across to Dr. Mehra. According to you, if at all, now that the states are bracing for another surge, in case the existing protocol, which is to a bare minimum in the current day, in case they have to be amended, what do you suggest?
Well, at the moment, as I said, I would strongly advise immunocompromised people to wear the mask. I will not advise everyone to wear the mask. You saw that the IPL, the numbers are growing in two states, Maharashtra and Kerala actually. Maharashtra, because you saw that the IPL games were done. There were lakhs and lakhs of these guys in these stadiums and all. The numbers are expected to rise, but there's no cause of worry as yet. The numbers are really much lower than that you're seeing in Europe and North America. I was in Europe maybe 10 days ago, and I was seeing that nobody was wearing a mask, and the mandate for the mask is gone on. In fact, you saw in May last month, there was an advisory from the CDC Atlanta. CDC Atlanta said that the fully vaccinated individuals do not no longer need to wear the mask every time.
Right.
But they fail to warn the immunocompromised people. And I'm here again and again saying that the people who are immunocompromised, known to be immunocompromised, they are on drugs and all that, they must go back to their doctor, and they are the ones that should not come out unless they're wearing a mask.
Definitely. Important advice there, because as we see at public places, trains, parks, beaches, while everybody is without mask, it would be hard to believe that none of them, or rather not a single person over there is not sort of not immunocompromised. So definitely, if you are suffering from certain existing ailments and diseases, it is advisable that you wear your mask. One last question from Dr. Sanjith. So, as we're seeing all these protocols, perhaps now they're not in place, but if at all, the same question I'd like to ask you as well, if at all the protocols have to be amended, what would you suggest, considering that in most part of India, monsoon is round the corner, and as we head to monsoon, we do see an increase in flu-like symptoms across all age groups?
You're absolutely right. As we head into the monsoon, there is going to be an increase in flu-like illness. There is no doubt. But as Dr. Mehra clearly mentioned, I think the protocols should be wear your mask. That is the most important thing. And especially in the subgroup of patients who are vulnerable, comorbids, diabetic, hypertensive, immunocompromised states, malignancy, and elderly population. These are our population that may at times enter into the hospital. Otherwise, everybody else, it's important to avoid crowd spaces, because it might be you who might be going home and infecting your own grandfather, mother, or your elderly people who are immunocompromised.
There you heard it from the experts today. Thank you so much, Dr. Mehra and Dr. Saseedharan, for sharing your opinion with Mirror Now this evening. Appreciate it. Thank you.
Thank you.